Yes, sir. A very warm good evening to one and all. Welcome back to today's session. Today our speaker is Jayita ma'am. Ma'am is a renowned speaker and ma'am has did BHMS and LLM in criminology and medical officer in homeopathy, government of Haryana. Actively participated in various BJPCP campus at college, ISKCON, community centers, etc. Ma'am has also published various research papers and socialization and generalized anxiety and other topics also. And ma'am is also an active RSS member at Gurgaon level, organizing free medical camps for charitable schools, received various awards at distinct from SDM and also from the various news channels. And we welcome you, ma'am. We welcome all the participants to the today's session. And today's our topic will be of homeopathy role in management of Parkinson's disease. And we welcome you all from the team Aisha. The session is hand over to you, ma'am. Thank you.
Okay, ma'am. Thank you everyone for attending the session. The topic is homeopathic management of Parkinson's disease along with application of ACT. Now, ACT stands for acceptance and commitment therapy. It's a therapy under psychological domain, and I won't be taking much of the ACT right now. We'll be focusing more on the constitutional treatment of Parkinson's with homeopathy. So, Parkinson's, as we know, is a neurodegenerative disorder, firstly documented by Dr. James Parkinson's in year 1817 in his essay on the shaking palsy. Initially known as paralysis agitans and later coined into Parkinson's disease by Jean
Excuse me, ma'am. We are unable to hear you, ma'am.
of body twitching, including mild tremor, rigidity, bradykinesia. Stage 2 involves postural instability, depression, emotional disbalance in behavior and mood. Stage 3 involves mostly twitching of the muscles, facial muscles that can cause difficulty in swallowing, speech changes, urinary. Now, our homeopathy, it mostly is very efficient in treating the stage 1, stage 2, and stage 3, because stage 4 and stage 5 is reflects more of a severe disability and wheelchair bound or bedridden unless assisted. Aim and objective of the paper, the research paper that I have published, to understand the effectiveness of homeopathic medicines and repertorization in treatment of Parkinson's, to understand the application of various assessment tools, including life satisfaction questionnaire, unified Parkinson's disease rating scale, activity-specific balance confidence scale, PDQ 39, to understand the application of acceptance and commitment therapy, in understanding willingness, avoidance, struggle, suffering, to set short and long-term goals for better meaningful life. To understand the 6 pillars of Parkinson's disease, including attitude and relation, stress reduction, sleep, exercise, character traits, and nutrition. To understand the role of Ayush, Parkinson's disease questionnaire, activity-specific balance confidence scale, unified Parkinson's, life satisfaction, etc. So these are the main
Sorry to interrupt, ma'am. Actually, the screen sharing has been stopped, ma'am.
the history of the present illness contained the Parkinson's from which he was suffering. It was since 10 months. There was a decreased balance, handwriting, left hand dominant, tremor since 6 months. The past history included repeated viral pneumonia, influenza 3 years back, addiction habits nil. History of mental illness or psychosocial conditions included depression, long term depression. Investigations included magnetic resonance imaging, CT scan. Contraindications were hypertension. Current functional status was cannot drive. There was hardly no issues in dressing or bathing. So the gait, tone, strength, or sensation was found to have moderate bradykinesia. Babinskian reflexes were positive, including muscle weakness. Neurological findings included AROM, limited bilateral shoulder flexion and abduction. Patient health questionnaire. It contains, as I said, short-term goals and long-term goals that can be categorized and subcategorized into various others like performance, social skills training, etc. So the short-term goals that were found decline in, for example, walking dog in garden, writing journals that the patient used to do before the condition. Long-term goals: declining self-care, reading, going to nearby store. Uh, Birth balance scale (BBS), functional balance versus stroke, it was found to be 43. So we gave tarantula hispecanius. Now, coming to the repertorization, tarantula, the various symptoms that was found in this patient was paralysis, restlessness, 3 plus, restlessness, especially that aggravates in night, motion, constantly in the motion, and there was an excessive pain in the spinal region that was aggravated with touch. There was a walking impulse to anger, contain throwing things away at himself and others, and there was a desire of cold drinks. So the tarantula was found to be the best medicine through repertorization. So after follow-ups, we can see there was a there was just a second. Life satisfaction. Okay. So these are the graphs. Basically, it's a combined graph. Stage 1. Since she was suffering Parkinson's since 2 years, there was a decrease in balance, slurred speech, right hand dominant mostly it was found, tremor since 1.7 years. past history was head injury, addiction habits, no. History of the mental illness. The total score before giving the treatment was found to have PHQ 12, Parkinson's disease questionnaire 57%, ABC scale 47, Unified Parkinson's 50%, Life Satisfaction questionnaire 2, coming under acceptance and commitment therapy short-term goals. There was a decline in reaching out for the support group. Now, reaching out for support group, this is very essential, especially in Parkinson's patient, because there is a major decline when we say how they are efficient enough to balance the release was radiating type that extended downwards, and insensibility numbness 3 plus, and there she found very difficulty to get out of the bed, that aggravated everything, and the thirst was immense 3 plus. So we gave Kalmia, and the follow-up was taken every 20 to 30 days, which is very essential given the fact that we give one impotency, that we prescribe one impotency to any patient suffering from any kind of neurological or psychiatric condition, as per my experience. So the patient was found to have relief, and as I stated earlier also, now in this graph, in all the 6 graphs, the red one indicates Kalmia, and there was a very much decline in all the scales, all the assessment scales, as you can see. Now coming to the third patient. The patient was has been a bank manager, 67, male. The history of the present illness was it was an idiopathic Parkinson's, and he was suffering from since 7 to 8 months. There was altered postural reflexes with decreased balance, and right hand dominant, tremor since 5 months. Overweight, right wrist injury was found in the past history. Addiction habits was found to have yes. The patient was chronic alcohol. He was items. The score was found to have been 16. Parkinson's disease questionnaire 54%, 44% in ABC scale, and unified Parkinson's disease 60%. LISAT 3. These are all the assessment scores before the treatment, post scores. Pre-scores. Sorry. And acceptance commitment therapy, short-term goals, decline in gardening. The person was involved in some kind of dance program. There was a decline in that also. Exercise habits, individualized movement, goals, and treating pain. Prayer therapy, nil. BBS scale was found to be 41. Now coming to the repertorization of the patient, zincum metallicum. The potency was given 1M. Follow-up was taken in every 25 to 30 days for a year. And there was a shuffling and walking, trembling legs, weakness in fingers, and mental depression, sadness. This is the zincum metallicum, green one, in BBS scale 2, Unified Parkinson's Disease Rating Scale, Life Satisfaction Questionnaire, ABC scale, PDQ. Now coming to the discussion. Before going into the discussion, I want to include some facts from the review of literature, which is very essential, given the fact that homeopathic medicines, whenever prescribed, it is very necessary, especially in neurological and psychiatric condition, to understand the pharmacological action of the medicines. Okay, so review of literature, Nagpal et al. Reproved the drug Tarantula hispanica. Tarantulas get their name from a large wolf spider found around Taranto in southern Italy. Bell F. in 2000 states that, contrary to the biomedical model of health, homeopathy considers entire body in a holistic manner and provides services in a broader view with much responsibility. Joseph R.M. et al. 1998 states evidence found that homeopathic drugs improve sensation of well-being, support the working of ultra high dilution effects which otherwise cannot be proved. Roger et al. 1997 in his study found that sleep disorders three toxic components exist. GTX 1, 2, 3, and 5 are most potent with the LSDs 50 in male mice, resulting in depolarization, which are blocked by tetrodotoxin. This mechanism is the basis of the membrane depolarization in squid exon, given the fact that reaction toxins affect both cardiovascular and respiratory systems, in also the neurological conditions. Symptoms include burning sensation, etc. Kedu Ming in 1993 stated that zinc is an essential trace element in the human body, and is abundantly in the hippocampus and cerebral cortex. Zinc deprivation results in changes in behavior, learning, memory, and emotional stability. So coming to the discussion, The post and the pre-assessment scores using the available tools suggested average improvement in individuals after application of ACT and homeopathic medicines. Now, ACT, as we have mentioned in the heading also, ACT mostly works on principles including rich and meaningful life, values and goals and actions, solutions and long-term effects, willingness and action plan, relationship towards firstly yourself and secondly others, and mindfulness, relaxation, and breathing techniques. ACT or acceptance and commitment therapy is very essential given there is very much need of application of ACT along with the medicines to find a larger amount of improvement in such kind of individuals. There, under the discussion, there was also fair improvement in the current functional status, including gait, tone, strength, and sensations. The neurological findings and history of associated mental conditions show setting long-term and short-term goals in individuals. In early stages, including 1, 2, 3, homeopathy can be very much beneficial to stabilize the disease and delay further deterioration. Homeopathy can be a holistic approach to lower the side effects of various conventional medicines that causes digestive disorders, blood pressure, fluctuations, restlessness, depression, dizziness, arrhythmia, etc. The sole objective is helping the individuals in reduction of various higher doses of conventional medicines and also reduce the intensity of tremors, rigidity, bradykinesia, postural stability, lower confidence, depression, affecting largely the daily functioning of life. Essential to produce sufficient dopamine that is beneficial Parkinson's disease. Excess use of dairy products, soya products especially, all soya products are mostly contained in today's junk foods like Chinese and all. Caffeine, cold drinks, processed meat, sugar rich diet is harmful in long term and can be a major cause in causing the Parkinson's disease. Thank you. Thank you for listening.
Thank you, ma'am. Thank you for enlightening us with your valuable knowledge. Now we will be moving to the question and answer session, ma'am. Respected participants, if you have any questions, you are welcome actually. Ma'am, one of the participant has asked the slide PPT for the reference, ma'am, with your consent, ma'am.
References? I'm sorry, bibliography.
Means they want
Hello?
they want your consent that the whether the PPT can be shared with them, ma'am.
Yeah, sure, no problem. Because the paper has already been published. It's actually under publication with CCS University Merit. So no problem for me.
Sure, ma'am. Ma'am, one of the participant is asking, kindly explain the slide 10.
Slide 10. Slide
हाँ जी
10,
ma'am.
10, slide 10. Okay. Calmia latifolia. This is a repertorization of the second patient. As I've said, the Calmia patient, I need to explain the repertory sheet or the patient profile as a whole. Because in neurological or psychological conditions or psychiatric conditions, I should say, we need to I'm just saying सिर्फ repertorization करके या homeopathic case taking is not enough. The Kalmia, if you are asking separately, she was a female. She was a housewife, and the history of present illness included that she was suffering from PD since 2 years. There was a decreased balance and slurred speech, and right hand was dominant, including the tremors and everything. The tremors was found to be since 1.7 years. The past history included head injury. The head injury was caused around 20 years back. The addiction habits contained nil. History of mental illness or psychosocial conditions included anxiety and domestic violence. Domestic violence was 3 plus in this condition. In the investigations including single photon emission, computerized tomography, PET positron emission test. There are a lot of tests which neurologists suggest or advise to the patient. These are the main tests that I have mentioned in this. You can go for any test if that's available near you. Okay. The contraindications included diabetes, any kind of medical conditions that can cause any kind of emergency. So the contraindication was diabetes, and there was a I should say 3 plus lack of social support, which is very essential, as I said earlier, also in PD patients. Current functional status was there was no problem with stairs and bed mobility, decreased confidence.
Ma'am, actually, they are asking one more question, ma'am. Like पेशेंट प्रोफाइल के बेस पर एक्सप्लेन कर सकते हैं क्या मैम? लाइक दिस इज देयर क्वेश्चन मैम.
So the gate.
हेलो.
Hello, Haji ma'am.
हाँ जी मैम.
Haji ma'am. Should I continue?
हाँ हाँ जी मैम. जी मैम.
हाँ. Am I audible now? Okay. The tone or
यस
the
मैम.
gait was to have okay, low grip strength. Upper extremities contained painful sensation. AROM limited in bilateral hip extension. The assessment tools. These are the pre scores. Post course I've not mentioned separately. If anyone wants to know, then I can mention them. हालांकि मैंने already वो graphs में include करके रखा है. So from graphs also you can understand the scoring after giving the treatment or the post course. So these are the pre-scores. 12 Parkinson's questionnaire में 57%, ABC scale में 47%, Unified Parkinson's was found that contains 42 items. You can find all these assessment tools in net also, no issue. 50%, LISAT 2%. Now acceptance and commitment therapy, if you want to give, then you can, or you can take second opinion or intervention of a psychologist separately also. Decline in reach out for support groups, decline in proper nutrition, which is very essential given the fact that Parkinson's patient need to have a proper amino acids, protein, and zinc diet. So proper nutrition, family relationship, working on Nordic walking poles, not given prayer therapy, and Berg balance scale BBS 40%. And there was insensibility, numbness found, and maybe domestic violence, anxiety hai. If you go the drug remedy of Kalmia, you can find the symptoms in that. So इसके अलावा भी अगर आप चाहते हो तो I will tell you the Kalmia kind of neurological or psychiatric condition is best. We need to understand the pharmacological action. So the Kalmia के बारे में हमें एल्बर्ट सी रुडोल्फ एट एल के जो मतलब डॉक्यूमेंट्स हैं या रिसर्च पेपर है उसमें अच्छे से हमें मिल सकता है. As I've mentioned earlier also, the Gynotoxins of Calmia latifolia is very much effective in treating any kind of cardiovascular, respiratory, and neurological conditions. It causes, the mechanism is the basis of the membrane depolarization in squid axon, the positive inotropic effect in the mammalian myocardium, and may involve the Na plus or Ca2 plus exchange system. And symptoms include burning sensation in mouth, pharynx, अगर हायर पोटेंसी if it can be controlled ताकि कोई aggravation patient को और feel ना हो, then you can also go for higher potency. I never go for higher potency because मुझे लगता है 1M is sufficient enough. The red one is the Galmia latifolia. These are the post-course. The right side are the post-course, as you can found after giving the medicine and ACT therapy. Any more questions?
Any further more questions from the participants? They can put it in the chat box actually. I hope the participants have cleared their questions, it seems, ma'am. Respected participants, we have given one mail ID in the chat box. Kindly, you can mail to the mail ID to, someone who is in need of the PPT of these sessions. Yes, thank you.
Thank you, ma'am. Thank you, Lavanya ma'am. Thank you, Dr. Kingshuk sir, for this opportunity. I'm really sorry for the network interruption. So I really hope the paper that I presented will be useful further. Thank you so much.
Definitely, ma'am. Thank you, ma'am. Thank you so much for enlightening us with your valuable sessions. Thank you, participants, for your active participation. We'll be for moving forward with the lots and lots of sessions. We hope you are enjoying it, the webinar series, and hope we'll get back soon with a new session by tomorrow's. And happy to help you all, and we'll be going. Thank you all to the media partner Homeopathy 360 degrees for their extensive support. Thank you all. Good night. Thank you.